So yeah, it's
So
peptides.
beautiful. Because we don't have a lot of time, so I wanted to make sure we're gonna ask one or two questions on the supplementation side.
Okay.
Just to take that home, and then we're gonna talk about something that's very dear to his man, psychedelics, and I think it's a very hot topic today. It's very important to talk about.
Sure.
So we know that since 1941, and this was a statistics that we read, since 1941 to 2020, we've lost more than 78% of all the minerals within our soils. In order to have vitamins, you need minerals, and all these coenzymes and micronutrients come from a rich soil, right?
Correct.
As we like to say, most people biochemically look like the Sahara Desert, and they're supposed to look more like the Amazon of Brazil. Our biochemistries are dried up. And it's not just about using these hormones, but how do we build the value for a patient who looks at a supplement? Like, they don't look at it as a medication, right? And we can start from vitamin D that we try to explain to people. I don't know why they named it a vitamin, because it's truly a hormone, and it affects more than 10% of all our genes and brain health, immunological health, bone health, fat loss, all of that. Can you share your point of view on supplementation and the importance of it with
Absolutely. Well, supplementation is part of our greater approach to hormone supplementation therapies. And I agree with you 100%. Hormones are an important facet to improving quality of life, but we have to do other things. And things like eating well, good nutrition, low inflammation, low alcohol, exercise, meditation. And with our supplements, the reason why we need supplements is because when you use hormones, what do? Well, at the cellular level, they increase the quality of metabolism of the cells. And when you increase the metabolism of cells, what do you need? Things called cofactors. What are cofactors? All those vitamins, B1, B2, B5, B3, B6, B12, B9, minerals. Okay?
Trace minerals.
Trace minerals. And if you don't put them in, you run into trouble. And because we're so deficient, because we stopped doing the burning of the fields to get the potash, to get the plants to put their burnt, charred remains back into the soil with the nutrients, what they do is they cut it and they throw it away. So if they don't go and throw more nutrients into the soil is devoid, and you have
soil.
Right.
Depleted.
It's depleted. I mean, there was a study done from with spinach, canned spinach from World War II, and they looked at it in the late 1990s, and they saw that 40% of the iron was in the spinach. They were 100% in the 45 and 40% in the 90s.
Wow.
Okay, so you lost 60% of your,
decline.
and it occurs with everything else. We need copper for energy in the immune system. We need chromium. Yeah, we need chromium for helping us not to become diabetic. So we need to have supplementation, and I get it that patients go in and they just want testosterone. You tell them that, okay, if you're going to take testosterone, but you don't take DHA, you don't take pregnenolone, and you don't take your supplements, you're going to crash. You're not going to optimize it. So you don't want to optimize it, or you do want to optimize it.
Right.
Yeah.
Do it right if you're going to do it.
And it also creates an environment for disappointment, right?
Yes.
The person comes, they take it like, well, I feel okay. Well, I'm like, well, listen, you're not taking
Right.
all the other things that support LeBron James. The LeBron James.
We like to always describe it to a car, the machinery of
Right.
the body. People come with they want to take testosterone. We're like, okay, a car needs gas, it needs oil, it
Right.
needs electricity,
Hydraulic
and it needs
fluid.
all these parts for the thing to run.
Right.
Most people think they take testosterone and it magically works. It's still consuming cofactors and
Correct.
things in your body in order to make it work. And these are the things that we're talking about to supplement along with the therapy. It's crucial.
Right.
I love that we each all have own analogy.
I mean, it's
Saying
all
the
about
same
it,
thing.
right?
Saying the same
Saying
thing.
the
from
same
different
thing,
angles.
different
And can I
energies.
ask you a question? Because we were with your good friend Dr. Brian yesterday, Nathan Brian.
Nathan?
Right.
Sure.
What an incredible brain! I mean, I think after you, I talked to him, I feel dumb as hell. But he was talking about the value of nitric oxide.
Yes.
And I wanted to know, because it's something that we discovered after talking to him, the immense value on all our systems, including the brain.
Mm-hmm.
Where's your position on nitric oxide with in terms of supplementation and doing hormone therapy?
I've known Nathan for a long time. We did a study with one of his products on our veterans with blast trauma, and they did very well.
All right.
So we put him on his Neo 40 product, the Physician Professional Strength, which is nitric oxide from beets.
Right.
And the importance of nitric oxide for me is twofold. One is nitric oxide will increase the amount of these energy power plants in our cell called mitochondria. So the more mitochondria you have, the more energy you can make, and that energy is called ATP, adenosine triphosphate. So nitric oxide will increase the energy so you are able to repair things. You know, you've got a electric drill, and you're going to be, putting holes to screw something to the wall and so forth, but you have no electricity. You've got a tool, you've got an instrument, but you don't have the juice to supply it so it functions. That's what happens in the body. You can run out of power. So you've got all the tools, but they're not working. So nitric oxide helps to increase the amount of these mitochondria so that they can make more ATP. That's one side. The other is nitric oxide is very important in blood flow. So blood flow, if you increase the diameter of your arteries, your channels of blood flow in your body, you can diminish blood pressure. You can improve blood supply to the brain.
To the brain, yeah.
You can improve blood supply to the heart.
To the
to tissues all over the body, the hair, the scalp, the skin, everything. So nitric oxide is extremely important for every system in the body. Plus, it's a very special signaling chemical. And what a signaling chemical does is it goes and turns other systems on. And so we're just finding out, Nathan is the guru in the area of nitric oxide. I'm one of his, students, really. And he, 10 years ago started training me in nitric oxide, but I leave all that fine detail to him.
By the way, you two are my favorite Texans on the planet.
By the way, the way we describe all that scientific stuff you just gave is typically we say it's like your cells are they're choked out of oxygen, and when you take nitric oxide, it's like your body goes. It actually takes a breath, right? And now things can work again normally because you're getting enough oxygen supply. I actually told him when we did the interview with Nathan that I had my symptom was ED, and that I've actually cut down my Cialis dose, and I'm responding better with a lower dose and frequency using nitric oxide, and aside from all the other benefits that it brings, right?
Well, if you look at, not to get too technical, but if you look at the Viagra, Levitra, and Cialis, what do? Increase your nitric oxide for vasodilatation through PGE.
That's if you even have nitric oxide.
That's right, you got it. So taking it with one of his products and
boom, it's the synergy.
So
how do you mean that, boom?
Let's lead into the final topic of the day. There's so much, guys, that we would like to cover, but it's been very difficult to pack it all in one session. We'll probably need session 2, 3, and 27 to get through all of this. But let's talk about psychedelics.
Okay.
Things like the use of cannabis, CBD, psychedelic mushrooms, MDMA, ketamine IV therapy, and let's start with that first.
Yeah, it's a lot of stuff. I put the CBD and THC off to one side, and the reason is because the mechanisms by which it works are totally different. But there is one crossover that you may or may not be aware of, that when you smoke weed, Delta-9 THC will stimulate pregnenolone to increase production in the body, which goes back and blocks the CBD receptors, or the CB1 receptors.
Yeah, the one is in the brain, the CB2 is in the body.
Right, the one's in the brain. Right. And the benefit of CBD is that it drops the production of an inflammatory process called NF-kappa B. So the benefit is dropping inflammation, you sleep better. Dropping inflammation, you get less pain, because the brain is the center for determining whether or not that is going to hurt me, or taking a knife and stab myself, that'll hurt. Yeah. Will hurt you. Of course it's going to hurt.
Whether you sleep or not.
Yeah, whether you
If
sleep
you're in
or not.
ketamine therapy, I don't think you'll feel it.
So the CBD and the THC, combination stuff do very well. One of the things I like a lot about CBD is the fact that it blocks the ability of COVID to get into your cells through the ACE2 receptors. So it blocks it. Yeah, lots of articles out there on it blocking it. So I know people in my population who take CBD, or with or without THC, They haven't taken the vaccines. They've never gotten COVID, and they're exposed to people who are positive, their own family members, and they've never gotten it. And in the literature, it clearly states it. Anyway, so looking at things like psilocybin, ayahuasca, ibogaine, these are important new tools which have been around since psilocybin since the 50s, when Gordon Swenson went to Mexico and came back with psilocybin and started the process of us being educated on the benefits of psilocybin. And up until 1971, psilocybin was great for alcohol addiction, for cigarette smoking, for weight-related issues, because it had influence over depression and anxiety. And then in 1971, for some reason that I won't get into, the world put a squash on all these psychedelics and put it into what's called a Schedule I drug, which has no medical benefits and is highly addicting. Jump ahead to about 93, and they start having people going out and testing it out in other areas. What do they find? It has lots of medical benefits, and it's not addicting. And where is it helping? It's helping people with addictive personalities. And what's happened recently in the past 7-8 years is they found that the products, the DMT and the 5-hydroxy-DMT and some of the other structural differences, they stimulate a receptor in the brain that they call the 2-alpha serotonin receptor. Now, serotonin has always been believed to be the cause, when it's not high, of depression, and when it's normal, to be antidepressant. It's another story. But there's another receptor called the 2-alpha receptor, which is another receptor which hooks up with the ibogaine and the psilocybin and the other products. And what it does is it can reset the brain. So if you have problems with addiction or anxiety or depression, it will help to reset the brain. And one of the cases that I keep on referencing is one of a gal who accidentally took 3 to 4 times more of a psychedelic than she should have. She ends up in a toxic state, gets brought into a hospital. And before, the reason why she was taking it was because she had manic depression. She was hyper and depressed. So she'd go through these cycles of depression and being manic, hyper. And when she recovered from her toxicity, she woke up and it was gone. Wow. It reset her brain. It was 1,100 mics of psychedelic. Wow. And that was just amazing. And they're talking about it now in the neuroscience area, in the neuropsychedelic areas, or the psychedelic literature. So
that's amazing. I got to say a couple of things. First, we are not telling people to go do any illegal substances.
Yes.
Correct.
Don't go and try it. If it's legal where you are, that's different. For example, I know in Australia right now, psilocybin and MDMA have been approved for treatment of different psychiatric issues. In the US, the studies are ongoing, and I think psilocybin and MDMA are going to be the first one that are going to be FDA approved within the next 1 or 2 years. Yeah. Right now, we have ketamine, which we use for the treatment of treatment-resistant depression and anxiety. And what I've seen with psychedelics, and you're right, CBD and THC are from a different class. When we talk about the psychedelics, especially the classic psychedelics like psilocybin, ayahuasca, and the DMTs, they affect the serotonin receptor, very synergistic with testosterone, because testosterone does affect the serotonin receptor also. But you talked about neurogenesis. And this is what the psychedelics can do. They actually prove that by functional MRIs, that there is new growth of nerves happening with the help of those substances. So it's, for me, the way I see psychedelics, it's another tool in our tool belt.
Correct.
So when you have neuroinflammation or that non-neuropermissive brain environment, what do? You fix nutrition. You give the right cofactors, the right supplements, the right hormones. And then on top of all this, if you're not there, then psychedelic may be the last tool that we add to this.
I agree.
And that's where I think we're most excited about, because we know the research behind the slam dunk results on psychedelics to treat depression and anxiety and all these things. And I got to credit Doc for saying this. The big question for us at the beginning, when all this exciting research was coming on board, was, does someone need to be that messed up to actually benefit from an optimization perspective? Can you have that resetting of the brain, but kind of like a micro resetting that just kind of gets you re-inspired, gets you reconnected, gets you re-in-lined?
Yeah, that's the microdosing, and that's the aim, is to use low dose, the microdosing, to try and get that system to restart. Yeah. And I'm now working with 8 psychedelic centers throughout outside the United States, and it's because they were finding that those people who go on to our form of treatment to help them to reestablish a neuropermissive environment, when they subsequently get the psychedelic agent, it works better.
Yes.
And the reason why it works better is because the receptors, those 2 alpha receptors, are not functioning well with inflammation. So if you're able to reduce the inflammation, you get a invigoration or the availability of these receptors so they can work with whatever the psychedelic agent is. So we're getting feedback that the protocols are working
And just
very
my
well.
last question on that. So, because I have, this is personal to me. Have you had any experience with people, obviously the traumatic brain injuries cases that you work with using low dose ketamine or any other psychedelics to rewire?
Well, the ketamine, in the IV infusion of ketamine, it can last for 1 to 2 weeks. There's a nasal form of ketamine. I do have one gentleman military, who's using that, and that's what's keeping him going. As long as he uses it, he's feeling great. And at this point, I don't fully understand why he, out of our entire population of veterans, failed our protocol, because our protocol is not lifelong. Our protocol is to be used until they get back to 100% themselves, and then we pare down on the treatment so they're basically on nothing because they've repaired.
Right.
Right. I think it's very important for everybody hearing about this subject, because it's very delicate. And we're God-fearing men, and we understand that a lot of people are seeing this just like another business opportunity. Right. And it's just, bringing people through the door without filtering them properly if they're ready or primed to that experience. Yeah. So it's very important that if you do need help with something like that, give us a call and we'll point you in the right direction to somebody we feel comfortable with, because this is a delicate subject, and we want to make sure that if this is something you're going to dabble in, that you do it right. Yep. So before we close out, and I know we've covered
a lot,
but at the same time, we just scratched the surface. Is there anything that we might have missed out that you want to maybe leave the viewers with before we close out? Anything that you think is very important to close out with?
Well, the most important thing is that when you out there are making a decision on where to go for your treatment, you look for those people who take a holistic approach, not someone who just says testosterone, growth hormone, but will sit down with you and explain not only the philosophy, but the modalities, the treatment, the testing that is used and why that testing is utilized, so that you know that they have your best interest in mind and not their best interest. They teased me earlier that my focus in life is stopping the suicides in our veterans. It's not about me, it's not about what I've developed or what I keep on trying to do. It's about what I've done by showing it in the effects and benefits of others. And that's what these people here, and why I'm sitting here, is because these guys, over the time that I've known them, have matured to understand this is the optimal way in treating you. It's not about them, it's about you.
Right. Thank you, man. That's so humbling, man.
Thank you. For any guys to take my exam,
and to pass it.
Oh my God! Thank you so much, Doc. I mean,
appreciate it.
I've been a great fan of yours for many years, and you've been so gracious with your time and your energy, and it's deeply humbling to me to have you here, because that is really what we are. You know, we you know, sometimes we can be annoying and you know, take a lot of time. And, you know, but it's because we really, really want people to be intellectually involved in their process. We want them to understand the what, the how, and the why. More importantly, is because if you understand the why you're doing this, now you'll be empowered. You'll be in control. We don't want you to become dependent on me or you or anybody. We want you to understand it so that then you can take your own control and have your own life and have your own success. And we're just here in the background pumping you up, you know, and you're really relishing from your success. So thank you so much for giving us that philosophy and sharing that philosophy with us, man.
Thank you. My pleasure.
Well, guys, I think that pretty much covers whatever we were able to get through today. We thank you for watching. We hope you've learned as much as we have in this talk. And if you're interested in finding more about Mark Gordon's research and products or his practice, you can give us a call. We're a millennial pride provider. And if we can't help you, we'll point you to the man or in the right direction. And Mark, we want to thank you deeply for taking the time to sit with us here.
I appreciate it.
We look forward to working with you together and continuing to learn from your incredible work in regards to neuroendocrinology and everything that has to do with, you know, optimizing the human being.
I promise I won't remember the names though.
And just one thing before we go.
Right.
Just don't make your next exam as difficult, please.
Please.
And for you viewers at home, stay healthy.
And God bless.